Interim operational considerations for implementing the shielding approach to prevent COVID-19 infections in humanitarian settings. This is 2019. Let me just try to find better dates and stuff. Hold on. Alright, so we see this is 2020, so right there. King County, Washington. Used to live there. Forgetting. So, what exactly is this? I don't like it so far. This document presents considerations from the perspective of the U.S. Centers for Disease Control and Prevention, CDC, for implementing the shielding approach in humanitarian settings as outlined in guidance documents focused on camps, displaced populations, and low-resource settings. This approach has been documented and has raised questions and concerns among humanitarian partners who support response activities in these settings. The purpose of this document is to highlight potential implementation challenges of the shielding approach from CDC's perspective and guide thinking around implementation in the absence of empirical data. Considerations are based on current evidence known about the transmission and severity of coronavirus disease 2019 COVID-19. It may be revised as more information becomes available. Please check that. Excuse me. A shielding approach aims to reduce the number of severe COVID cases by limiting contact between individuals at higher risk of developing severe disease, high risk, and the general population, low risk. High risk individuals would be temporarily relocated to safe or green zones established at the household, neighborhood, camp, sector, or community level, dependent on the context and setting. They would have minimal contact with family members and other low risk residents. Current evidence indicates that older adults and people of any age who have serious underlying medical conditions are at higher risk for severe illness from COVID-19. In most humanitarian settings, older population groups make up a small percentage of the total population. For this reason, the shielding approach suggests physically separating high-risk individuals from the general population to prioritize the use of the limited available resources and avoid implementing long-term containment measures among the general population. Long-term containment measures. I wonder what they mean by that. In theory, shielding may serve as objective to protect high-risk populations from disease and death. However, implementation of the approach necessitates strict adherence to protocol. Inadvertent introduction of the virus into green zone may result in a rapid transmission among the most vulnerable populations. The approach is trying to protect. So it seems like they're just setting this up so we can they can just kill us off real fast, eh? I think that might be what it is. A summary of the shielding approach described by Favas and shown in Table 1. Table 1. Level. Household. Level. HH. A specific room area designated for high-risk individuals who are physically isolated from other household members. Movement interactions. Low-risk household members should not enter the green zone. If entry is necessary, it should be done only by healthy individuals after washing hands and face coverings. Interaction should be at a safe distance, approximately 2 meters. Minimum movement of high-risk individuals outside the green zone. Low-risk household members continue to follow social distancing and hygiene practices outside the house. Neighborhood level. A designated shelter group of shelters, max 5 through 10 households, within a small camp or area where high-risk members are grouped together. Neighbors swap, quote-unquote, swap households to accommodate high-risk individuals, same as above. Camp sector level. A group of shelters, such as schools, community buildings, within a camp sector, max 50 high-risk individuals per single green zone, where high-risk individuals are physically isolated together. One entry point is used for exchange of food, supplies, etc. A meeting area is used for residents and visitors to interact while practicing physical distancing, no movement into the or outside the green zone. Operational considerations. The shielding approach requires several prerequisites for effective implementation. Several are addressed, including access to health care and provision of food. However, there are several prerequisites which require additional considerations. Table 2 presents the prerequisites or suggestions as stated in the shielding guidance document, column 1. And CDC presents additional questions and consideration alongside these prerequisites, column 2. Suggested prerequisites per the shielding documents and CDC's operational considerations. Suggested prerequisites as stated in the shielding document. Each green zone has a dedicated latrine bathing facility for high-risk individuals. The shielding approach advises against any new facility construction to establish green zones. However, few settings will have existing shelters or communal facilities with designated latrines, bathing facilities to accommodate high-risk individuals. In these settings, most of the latrines used by households are located outside the home and often shared by multiple households. If dedicated facilities are available, ensure safety measures such as proper lighting, hand washing, hygiene infrastructure, maintenance and disinfection of latrines. Ensure facilities can accommodate high-risk individuals with disabilities, children, and separate genders at the neighborhood camp level. Infrastructure. Is this what they're building with the infrastructure? To minimize contact, each green zone should include able-bodied, high-risk individuals capable of caring for residents who have disabilities or are less mobile, otherwise designated low-risk individuals for these tasks, preferably who have recovered from confirmed COVID-19 and are assumed to be immune. This may be difficult to sustain, especially if the caregivers are also high risk, as caregivers may often will be family members. Ensure that this strategy is socially and culturally acceptable. Currently, we do not know if prior infection confers immunity. The green zone and living area for high-risk residents should be aligned with minimum humanitarian standards. Sphere standards. Minimum green zone high-risk residents should be aligned. What word? Sphere? Did I miss something? What does that mean? I don't know. Anyways, the shielding approach requires strict adherence to infection prevention and control. Prevention and control, IPC measures. They require uninterrupted availability of soap, water, hygiene, cleaning supplies, masks, cloth, face coverings, etc. for all individuals in green zones. Thus, it is necessary to ensure minimum public health standards are maintained and possibly supplemented to decrease the risk of other outbreaks outside of COVID-19. Attaining and maintaining minimum sphere standards is difficult in these settings for the general population. Users should consider that provision of services and supplies to high-risk individuals could be at the expense of low-risk residents, putting them at increased risk for outbreaks. Monitor and evaluate the implementation of the shielding approach. Monitoring protocols will need to be developed for each type of green zone. Dedicated staff need to be identified to monitor each green zone. Monitoring includes both adherence to protocols and potential adverse effects or outcomes due to isolation and stigma. It may be necessary to assign someone within a green zone, if feasible, to minimize movement in and out of green zones. Men and women and individuals with tuberculosis, TB, severe immune deficiencies, or dementia should be isolated separately. Multiple green zones should be needed to achieve this level of separation, each requiring additional inputs and resources. Further considerations include challenges of accommodating different ethnicities, socio-cultural groups, or religions within one setting. I'm sorry, I'm like thinking about this, and it's almost like, remember like the FEMA camps? Community acceptance and involvement in the design and implementation. Even with the community involvement, there may be a risk of stigmatization, isolation, separation from family members, loss of freedom, and personal interactions may require additional psychosocial support structures. What the? Blast it. Sorry. Pardon me. Additional psychosocial support structure systems, and see section on additional considerations below. High-risk minors should be accompanied into isolation by a single caregiver who will also be considered a green zone resident in terms of movements and contacts with those outside. Protection measures are critical to the implementation. Ensure that there's appropriate, adequate, and accessible care of minors or individuals with disabilities or mental health conditions who remain in the household if separated from their primary caregiver. I mean, and that's the thing, talk about destroying the family. Green zone shelters should always be kept clean. Residents should be provided with the necessary cleaning products and materials to clean their living spaces. High-risk individuals will be responsible for cleaning and maintaining their own living space and facilities. They may not be feasible for persons with disabilities or decreased mobility. Maintaining hygiene conditions in communal facilities is difficult during non-outbreak settings. Consequently, it may be necessary to provide additional human resource support. You have people with guns. Green zones should be more spacious in terms of shelter area per capita than the surrounding camp sector, even at the cost of greater crowding of low-risk people. Green zones should be more spacious in terms of shelter area per capita than the surrounding camp sector, even at the cost of greater crowding of low-risk people. Ensure that targeting high-risk individuals does not negate mitigation measures among low-risk individuals. Physical distancing in markets or water points where feasible, etc. Differences in space, blast it. Differences in space based on risk status may increase the potential risk of exposure among the risk of low-risk residents. It may be unacceptable or impractical considering space limitations and overcrowding in many settings. Additional considerations: the shielding approach outlines the general logistics of implementation, who, what, where, how. However, there may be additional logistical challenges to implementing these strategies as a result of unavailable commodities, transport restrictions, limited staff capacity, and availability to meet increased needs. The approach does not address the potential emotional, social, cultural, psychological impact for separated individuals, nor the households with separated members. Additional considerations to address these challenges are presented below. Population characteristics and demographics. consideration, the number of green zones required may be greater than anticipated, as they are based on the total number of high-risk individuals, disease categories, and socio-demographics of the area, and not just the proportion of elderly population. Explanation: older adults represent a small percentage of population in many camps and humanitarian settings, approximately 3 to 5%. However, in some humanitarian settings, more than a quarter of the population may fall under high-risk categories based on underlying medical conditions, which may increase a person's risk for severe COVID-19, which may include chronic kidney disease, obesity, serious heart conditions, sickle cell disease, type 2 diabetes. Additionally, many camps and settlements host multiple nationalities, which may require additional separation. For example, Kakuma refugee camp in Kenya accommodates refugees from 19 countries. Timeline consideration. Plan for an extended duration of implementation time, at least 6 months. Explaining. I think they've actually done this mildly, to be honest with you. Explanation. Given the plan for extended duration of implementation time. Explanation is still an approach that the green zones may be maintained until one of the following circumstances arise: sufficient hospitalization capacity is established, effective vaccine and therapeutic options become widely available, or the COVID-19 epidemic affecting the population subsides. Given the limited resources and healthcare available in populations and humanitarian settings prior to the pandemic, it's unlikely sufficient hospitalization capacity, beds, personnel, equipment, ventilators, and staff will be achievable during widespread transmission. The national capacity in many of the countries where these settings are located, Chad, Myanmar, Syria, is limited. Resources may become quickly overwhelmed during the peak of transmission and may not be accessible to the emergency affected populations. Vaccine trials are underway, but with no definite timeline. Reaching the suppression phase, where the epidemic subsides, can take several months, and cases may resurge in a second or even third wave. Herd immunity, the depletion of susceptible people for COVID-19, has not been demonstrated to date. It is unclear if the infected person develops immunity, and the duration of potential immunity is unknown. Thus, contingency plans to account for possibly extended operational timeline are critical. Hold on a second. Other logistical considerations. Plan to identify additional resources and outline supply chain mechanisms to support green zones. Explanation. So really, green zones are freaking red zones. If I'm understanding this correctly, because that's where the high risk people. But it's just softer, I think. The implementation of operation of green zones requires strong coordination among several sectors, which may require substantial additional resources, supplies, and staff to maintain these spaces. Shelter, infection prevention, control, is that what IPC? Water, sanitation, and hygiene, wash, non-food items, beds, linens, dishes, utensils, water containers, psychosocial support, monitors, supervisors, caretakers, attendants, risk communication and community management, engagement, security, etc. Considering global reduction in commodity shortages, movement restrictions, border closures, and decreased trucking and flights, it is important to outline what additional resources will be needed and how they will be procured. Protection. Wait, is that? Never mind. Alright, so protection, consideration, and ensure safe and protective environments for all individuals, including minors and individuals who require additional care, whether they are in the green zone or remain in a household after the primary caregiver or income provider has moved to the green zone. exploitation, separating families and disrupting and deconstructing multi-generational households may have long-term negative consequences. Shielding strategies need to consider socio-cultural gender norms in order to adequately assess and address risk to individuals, particularly women and girls. Restrictive gender norms may be exacerbated by isolation strategies such as shielding. At the household level, isolating individuals and limiting their interaction, compounded with social and economic disruption, has raised concerns of potential increase blast. Pardon me. At the household level, isolating individuals and limiting their interaction, compounded with economic disruption, has raised concerns of potential increased risk of partner violence, households participating in house swaps, or sector-wide cohorting are at particular risk for gender-based violence, harassment, abuse, and exploitation, as remaining household members may not be decision makers or responsible for household's needs. Do we actually own anything? Social, cultural, religious practices plan for potential disruption of social networks. Community celebrations, religious holidays, bereavement, funerals, and other rites of passage are cornerstones of many societies. Proactive planning ahead of time, including strong community engagement and risk communication, is needed to better understand the issues and concerns of restricting individuals from participating in communal practices because they are being shielded. Failure to do so could lead to both interpersonal and communal violence. Mental health. They're trying to put us through a psychological episode. That's what's happening here, and they're just trying to. This is all part of the programming. Mental health consideration. Ensure mental health and psychosocial support structures are in place to address increased stress and anxiety. Additional stress and worry are common during any epidemic. It may be more pronounced with COVID-19 due to the novelty of the disease and increased fear of infection, increased child care responsibilities due to school closures, and loss of livelihoods. Thus, in addition to the risk of stigmatization and feeling of isolation, this shielding approach may have an important psychological impact and may lead to significant emotional distress, exacerbate. I can't fucking read. Existing mental illness or contribute to anxiety, depression, helplessness, grief, substance abuse, or thoughts of suicide among those who are separate or have been left behind. Shielded individuals with concurrent severe mental health conditions should not be left alone. There must be a caregiver allocated to them to prevent further protection risks such as neglect and abuse. Oh my God. The shielding approach is an ambitious undertaking which may be prove more effective in preventing COVID-19. Check out Sticks. Anyways, while the premise is based on mitigation strategies used in the United Kingdom, there is no empirical evidence whether the approach will increase, decrease, or have no effect on morbidity or mortality during COVID-19 epidemic in various humanitarian settings. This document highlights risk, challenges of implementing this approach, need for additional resources in areas with limited or reduced capacity, indefinite timeline, possible short-term and long-term adverse consequences. Public health not only focuses on the eradication of the disease, but addresses the entire spectrum of health and well-being. Populations displaced due to natural disasters or war and conflict are already fragile and have experienced increased mental, physical, and or emotional trauma. While the shielding approach is not meant to be coercive, it may appear forced or be misunderstood in humanitarian settings. Primary rate limited. Pardon me. As many community interventions met to decrease COVID-19 morbidity and mortality, compliance and behavior change are the primary rate limited steps. It may be driven by social and emotional factors. These changes are difficult in developed, stable settings, thus may be particularly challenging in humanitarian settings, which bring their own set multifaceted challenges that need to be taken into account. Household level shielding seems to be most feasible and dignified as it allows for the least disruption to family structure and lifestyle, critical components to maintaining compliance. Compliance. So, there's just these little trigger words in there. However, it is most susceptible to the introduction of a virus due to necessary movement or interaction outside the green zone, less oversight, and often large household sizes. It may be less feasible in settings where family shelters are small and do not have multiple compartments. In humanitarian settings, small village, sector, block, or camp level shielding may allow for greater adherence to proposed protocol, but at the expense of longer term social impacts triggered by separation from friends and family, feelings of isolation, stigmatization, most importantly, accidental introduction of the virus into the green zone may result in rapid transmission, increased morbidity and mortality, as observed in assisted care facilities in the U.S. Cuomo. Oh yeah, we're not going to impeach him. There's no need to. He's resigning. But we're going to impeach a president that's leaving office. Yeah. How'd that go? The shielding approach is intended to alleviate the stress on the healthcare system and circumvent the negative economic consequences of long-term containment measures and lockdowns by protecting the most vulnerable. Implementation of this approach will involve careful planning, additional resources, strict adherence, and strong multi-sector coordination. Police, government, hospitals, businesses, multi-sector coordination, requiring agencies to consider the potential repercussion among populations that have collectively experienced physical and psychological trauma, which makes them more vulnerable to adverse psychosocial consequences. In addition, thoughtful consideration of the potential benefit versus the social and financial costs of implementation will be needed in humanitarian settings. And this is a year old and stuff. And what I'm going to do is just kind of go through this real slow. So if you want to put this on mute and read it for yourself, you can just kind of pause it. Well, shit. Yeah, I don't know. Let me just post this. All right. Take care, be safe, be kind, stay strong. Love you all. And this is just kind of weird.